she's explaining that the four major points for respiration to occur are pulmonary ventilation, where air moves in and out of the lungs; external respiration, where oxygen diffuses into the blood; the transport of the gases, such as oxygen and carbon dioxide, to and away from cell tissues; and internal respiration, where the oxygen actually diffuses into those tissues. When any one of these things does not occur, you can have respiratory failure. The 5 general issues that cause low oxygenation are hypoventilation, where there is reduced airflow to the lungs; intrapulmonary shunting, where you may have issues with the alveoli collapsing; ventilation perfusion mismatch, where there's a lack of blood flow to the lungs or to the alveoli in the lungs; diffusion defects, where gas cannot cross the capillary alveolar barrier; and decreased barometric pressure, typically due to altitude sickness. Now we're at the local ER, where Nurse Fifi is taking care of a local patient, Miss Brown, who came in after a motor vehicle accident. After taking her vital signs, the nurse realized that the patient had a low pulse oximetry reading, indicating low oxygen saturation in her bloodstream. So she administered oxygen at 2 liters a minute beginning, and she's continuing with the vital signs on a continuous reading, and will then go and notify the provider. A few days later, Miss Brown is still in the hospital. The provider has now ordered sedation in order to reduce the oxygen demand. She's also on 100% oxygen through a non-rebreather mask with positive end expiratory pressure, or PEEP. She's on a continuous IV flow with total parenteral nutrition flowing in order to support her nutrition during this time. Right now, the provider believes she is in stage 3 of acute respiratory distress syndrome. The nurse once again assesses the vital signs and looks at the ABGs, arterial blood gases. On assessment, the nurse realizes that even on 100% oxygen, the patient is still not improving. So she goes back and notifies the provider. While talking to the provider, Mrs. Brown's x-rays come back and shows a ground glass appearance on her chest, which confirms that infiltrates are in the lungs, showing that she is in the 3rd phase of acute respiratory distress syndrome. Mrs. Brown has now been turned into the prone position in order to better facilitate respirations. Nurse Fifi's back, once again taking vital signs, one of the most important things a critical care nurse can do. Since it's before day 14, she's also checking the IV and preparing to administer corticosteroids. She begins by checking what IV fluid is infusing, and then checking with the pharmacy to confirm that she can use the same port for the corticosteroid administration. After conferring with the pharmacist, the nurse realizes that it is acceptable to administer the corticosteroid through the same port. She infuses the corticosteroid, which would probably be prednisone or cortisone at this point. This is in order to reduce the inflammation in the lungs associated with ARDS. The patient is then assessed once again. Upon assessment, the nurse realizes that the patient is starting to have signs of further deterioration. At this point, she goes and talks to the provider about the possible progression of the ARDS into multi-organ dysfunction. Now that Mrs. Brown is in phase 4 of acute respiratory distress syndrome, she has fibrosis in her lungs, which is an irreversible change. The major complications after a patient gets severe cases of ARDS is multiple organ dysfunction, sepsis, and pneumonia. Unfortunately, Mrs. Brown has developed multiple organ dysfunction, and her family has decided to go ahead and disconnect her from the ventilator due to her advancing age. After withdrawing the treatment, Mrs. Brown has slowly tapered off and passes away. After Mrs. Brown's death, Nurse Fifi takes time to review her material on how ARDS progresses. She learns that in phase 1, pulmonary capillary injury, probably caused by the motor vehicle Mrs. Brown suffered, causes the inflammation response. Neutrophil and inflammatory mediators activate and increase capillary permeability in the lungs. This causes dyspnea and tachypnea. which is typically caused by the edema due to capillary permeability. She learns then that during phase 2, inflammation causes vasoconstriction. This results in pulmonary hypertension and a VQ mismatch. The infiltrates form from the increasing edema, and the VQ mismatch causes surfactant production in the lungs to stop. Phase 3 of ARDS occurs between days 2 and 10. Hypoxemia results even with high levels of oxygen therapy. For instance, the normal therapy is 100% oxygenation via non-rebreather mask or intubation with positive end expiratory pressure. Even with these high levels of oxygen, the patient's oxygen level is barely maintained or is not maintained. During the final phase of ARDS, which occurs after day 10, fibrosis of the lungs occurs. At this point, survivability diminishes to in the 70th percentile. The lung injury is then irreversible due to the fibrosis. Patients who reach this phase may be on a ventilator for weeks to months. Even with advanced medical technology and progressive therapy, some patients may not survive.